Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist. I've been a cardiologist for 40 years in the Houston area, and this is a series of lectures on your heart. The focus of this presentation is women and heart disease. Heart disease is the number one killer of women, especially in the postmenopausal era. So let us begin with the feature presentation and look at what are the warning signs of heart disease and what are the warning signs of an impending heart attack. Women and heart disease. 1 in 3 women have heart disease or stroke that kills them. 80% of this can be preventable. Between 1980 and 2010, there has been a dramatic decline in the incidence of heart attacks among women. Still, heart attacks and coronary artery disease are the leading cause of death in women, especially in the postmenopausal period. What are the warning signs of a heart attack in a woman? Unlike symptoms in men, the symptoms of an impending heart attack in women are quite different, and a proper education of the medical professionals is of great importance in recognizing these vague symptoms and link them to possible heart attack so that an early diagnosis can be made and a lot of lives can be saved. The symptoms that are typically seen in women with an impending heart attack are having jaw pain, which is also seen in male patients. But sometimes they may present predominantly with shortness of breath. You can follow this white arrow here. They can present with shortness of breath, or they may have pressure in the chest. Maybe not a typical sharp pain that is relentless, that continues for like minutes or hours. They may present with just nausea and vomiting. They may also present with some discomfort in both arms. Generally, we see a chest pain radiating to the jaw, to the left arm in a male patient, but we may not see those typical symptoms in a female patient. Occasionally, they may present with just back pain. Sometimes their only symptom may be fatigue and weakness. Some of them may present with some dizziness. The symptoms of a typical heart attack that we see may not be present in female patients, and it is important for the patient, and also to the doctors to recognize these non-conventional symptoms of heart attack and do pay attention to them, do appropriate studies, and once you recognize the presence of a heart attack, treat them appropriately. There are a few other facts that we need to keep in mind when it comes to women. Women have the same risk factors as men, such as high blood pressure, diabetes, obesity, high cholesterol, smoking, and family history. Women get the same incidence of heart attack as men, it just happens 10 years later. Women also have small coronary arteries compared to those in men. As a result, their lumen or the caliber is small, which is more prone for blockages due to sluggish blood flow. And women have a heart attack, their recovery is quite slow and hampered because of multiple factors. And hence, it is more important to educate the medical professionals. I'm glad many women are going into the field of medicine and cardiology, and hopefully they would be able to recognize these non-conventional symptoms of an impending heart attack among women and bring them to the medical attention so that many lives can be saved. Let's look at heart attack symptoms among men compared to women. Men have typical left-sided crushing chest pain associated with sweating, weakness, pain radiating to the left arm, to the jaw, they're having shortness of breath, and occasionally heartburn. Whereas with women, the symptoms are quite different. As I said, they can have dizziness, just uncomfortable feeling, shortness of breath, indigestion, or unexplained fatigue and weakness. If you are experiencing any one of these unconventional symptoms that you are not supposed to be having, then get medical attention. Visit your family doctor, see a cardiologist, get appropriate tests done, and get the treatment that can save your life. To conclude, heart disease is the number one killer in women, especially in the postmenopausal age. The symptoms of a heart attack are vague, but if you experience anything above your diaphragm that you're not supposed to be feeling, and if you're feeling uneasy, fatigue, dizziness, shortness of breath, all of these could be symptoms of an impending heart attack. Take charge of your heart. Take charge of your life. Thank you so much for watching. This has been a presentation of Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. I have numerous educational videos on recognizing the risk factors, how we modify the risk factors, and we talk about diet, exercise, lifestyle changes to minimize the risk of heart disease and heart attack. Please do watch them, and please do subscribe to our YouTube channel. I will see you in the next video.